Dr. Crucifix Pender from the Department of Pharmacology and Toxicology, School of Medicine and Pharmacy, College of Medicine and Health Sciences, University of Rwanda. We'll be discussing pharmacology of Alzheimer's disease. As a general introduction, this topic provides information on the pathogenesis of Alzheimer's disease, including the various hypotheses to explain the pathogenesis, the drugs used for the management of the condition, clinical uses, and adverse effects associated with the use of these drugs. The study objectives of this topic are as follows. 1. To know the pathogenesis of Alzheimer's disease. 2. To know the drugs used for the management of this condition. 3. To know the mechanism of action of the drugs used, clinical uses, as well as their adverse effects. Now, the intended study outcomes. Having successfully completed this unit, students should be able to 1. Explain the pathogenesis of Alzheimer's disease, know and apply the drugs used in the management of Alzheimer's disease, understand the mechanism of action of the drugs used, their clinical uses, and adverse effects associated with the use of these drugs. Now, Alzheimer's disease is a progressive neurodegenerative disease that leads to symptoms of dementia. The pathophysiology of this condition is quite complex and not entirely understood. However, there are different hypotheses that have been used to explain the cause of Alzheimer's disease. The most popular of these hypotheses includes 1. The cholinergic hypothesis, which states that a possible cause of Alzheimer's disease is a loss of central cholinergic neurons and ensuing deficiency of acetylcholine, which is a very important neurotransmitter for memory and learning. Number 2 hypothesis is the amyloid hypothesis, which says that Alzheimer's disease may be caused as a result of amyloid plaques that may be deposited in the brain, and beta amyloids have been shown to be a very important cause of Alzheimer's disease, and as such needs to be looked into. In Alzheimer's disease, beta amyloid clumps together to form amyloid plaques, which are thought to induce what is called neuroinflammation and disrupt communication between neurons. Another hypothesis is the tau hypothesis, which proposes that Alzheimer's may result from abnormal aggregation of tau proteins that leads to the formation of tangles within nerve cells in the brain. In a healthy brain, the tau proteins helps to lengthen and support microtubule structure. Now, microtubules play crucial roles in transport of nutrients and information molecules throughout the brain or throughout the neuron. So, when tau dissociates, the microtubule assembly becomes compromised, thereby disrupting the neuron's transport system, leading to symptoms of Alzheimer's. And because this one can even cause disruption in biochemical communication between neurons. Now, looking at the treatment of Alzheimer's disease. Regarding treatment, current therapeutic options are limited to drugs that provide only mild symptomatic benefits. They are divided into two classes. 1. Cholinesterase inhibitors. 2. NMDA receptor antagonists. Now let's look at the cholinesterase inhibitors. Under normal conditions, cholinergic neurons in the brain synthesize acetylcholine from acetyl coenzyme A and choline in a reaction catalyzed by an enzyme called choline acetyltransferase. Upon arrival of neuronal impulse, synthesized acetylcholine present in the synaptic cleft acts on receptors to bring about actions. Now, after the activity of the acetylcholine being produced, two enzymes known as acetylcholinesterase enzyme and butyrylcholinesterase enzyme break down acetylcholine into acetate and choline, thus terminating its action. Now, since Alzheimer's disease has been linked to a deficiency of acetylcholine in the brain, cholinesterase inhibitors were introduced to alleviate the symptoms of the disease. As their name suggests, cholinesterase inhibitors they simply work by inhibiting cholinesterase enzyme from breaking down acetylcholine, thereby increasing the availability of acetylcholine in synaptic clefts, which eventually will bring about relief in Alzheimer's disease. Now, the three commonly used or prescribed cholinesterase inhibitors are 1. Donepezil, 2. Rivastigmine, 3. Galantamine. It is important to understand or to note that out of the three drugs, rivastigmine is the only one that shows significant inhibition of both acetylcholinesterase enzyme and butyrylcholinesterase enzyme. When it comes to side effects, they can range from mild, such as nausea, vomiting, and even diarrhea, and to some other adverse effects, such as slow heartbeat, lack of appetite, and others. NMDA receptor antagonists. Now, these are agents that help to block NMDA receptor used in the management of Alzheimer's disease. Now, the NMDA receptors belong to the family of ionotropic glutamate receptors, which mediate most of the excitatory synaptic transmission in the brain. They are thought to play an important role in learning and memory formation. Now, research suggests that beta amyloid proteins that accumulate in the brain of Alzheimer's patients may cause abnormal rise in extrasynaptic glutamate levels by inhibiting glutamate reuptake or triggering glutamate release from glial cells. As already known, the binding of glutamate to NMDA receptors can lead to influx of calcium, which can promote action potential generation, leading to activity of glutamate on the cells, and this can cause cell death, as we know. So when glutamate levels become abnormally elevated, of course, there will be extra stimulation or overstimulation of NMDA receptors, and this can lead to cell rupture and even cell death. To address this, scientists have developed NMDA receptor antagonists known as memantine, which works by blocking NMDA receptors and thus limiting calcium inflows into the neuron. Common side effects of this drug called memantine include diarrhea, headache, and even insomnia. Of course, it is expected because of the serious activity of glutamate on the receptor lead to overexcitation and all of that, which leads to insomnia or what we call lack of sleep. Now, future of Alzheimer's disease treatment. Since we have known the different hypotheses of Alzheimer's disease, where we have talked about the involvement of amyloid proteins, the involvement of tau proteins, therefore, scientists are looking at the possibility of targeting these proteins that are causing Alzheimer's disease, so as to bring about holistic treatment in this condition. Now, as an illustration, we can see the cholinesterase inhibitors like donepezil, rivastigmine, galantamine. We can also see the NMDA receptor antagonists known as memantine, used for the management of Alzheimer's disease. One of the major promising targets for drugs is beta amyloids, as earlier mentioned. Researchers are investigating agents that may prevent beta amyloid fragments from clumping into plaques by targeting two enzymes called the beta secretase enzyme and the gamma secretase enzyme, which sequentially cut the amyloid precursor proteins to generate the pathological beta amyloid peptides. In another approach, researchers have also been able to target the beta amyloid by synthesizing antibodies, which will help to clear these beta amyloids from the brain. The second major target of future therapy is tau proteins, as earlier mentioned. The main component of tangos is the tau protein. Just like with beta amyloid, antibodies capable of binding and clearing pathological tau proteins are being developed and tested. Another area of extensive research involves compounds that prevent tau proteins from aggregating. And so, once this is able to be developed, this will prevent occurrence or emergence of Alzheimer's disease. Thank you very much. I hope you have learned about Alzheimer's disease, management, including different drugs used for management of this condition. Thank you.